You can talk and everybody can hear you. Ladies and gentlemen, everybody can always hear me.
Okay.
I mean, you could be in Nebraska. I'm broadcasting from New Jersey right now. Everybody can hear me. But that's because I am Dr. Pete, and you're joining us again with another edition of the Local Bizcast. Welcome, everybody. I have a good friend of mine over here. We've been doing business for years, Mr. Michael Magaro of the Benefit Bureau.
How are you today?
Welcome.
Thank you so much.
I'm going to have to talk into that thing. There
All
we go.
right.
We got
Thank you so
now.
much.
Ladies and gentlemen, as always, we are trying to grow our channel, and I require your support. I need you guys all hit over to YouTube, Spotify, Apple Podcasts. Like if I do this in social media, you know how they like point?
Right.
YouTube, Apple Podcasts, Spotify. Go hit like, subscribe. Always contact me. I'm always looking for new guests on here. We're always looking for new industries. And it doesn't matter if you're a seasoned veteran and you've been in business for 50 years or you just started yesterday. We want to hear your story. We want to know what you guys need. That's what it is here for. Local Bizcast. All your needs. Some people need customers. Some people need employees. Some people need to find vendors. That's what we're here for, ladies and gentlemen. The Local Bizcast, but enough business for now. Ladies and gentlemen, Mr. Michael Magaro, the Benefit Bureau. Again, welcome.
Thank you so much for having me.
The Benefit Bureau. I mean, you know, is one of those from Wolf of Wall Street type of thing. You're like, gotta make this as yeah. Is that what it was?
Exactly from.
There we go.
Yeah.
Benefit Bureau. What is the Benefit Bureau?
Benefit Bureau is great. When my cold caller calls, people think it's serious. It's something that they should listen to for a second. And that's how he gets in the door. But it's basically I care more about health insurance than any other part of my business.
There we go.
So it's working out well.
Yeah,
But
so I am not only a friend, but I'm also a client, so I could speak specifically about what you have done for us, so that's going to be helpful, of course. Right. But, I mean, we just heard a nice little pearl of business, right? You got your foot in the door because of the name of the business that you did. It sounds, almost like legal, official. That's the word I was looking for. Very nice. Yeah. I'm going to change the name of my office now. It's no longer called the Spine and Health Center. It's called the Federal Bureau of Manipulation.
Hey, we need that these days.
Oh, God, isn't that the truth? So, all right, so it's mostly health insurance.
Yes.
Is that, and you're a broker? What would you call yourself?
Independent broker.
Independent broker.
Can use any carrier I want. Nobody can get a better price than I can. I can't get a better price than they can.
You got to say that slower and louder. Nobody can get a better price than you can. And you can get it from anybody. You're not locked in, because a lot of brokers are locked into like one or two carriers.
I go to whoever I want to go to, and I go to the specific ones these days. There's a couple that I do not go to because their service is so horrible. And when the service is horrible, then it doesn't work for me, because then clients are complaining. And if they're not going to be happy with the product, then they're not going to be happy with us.
Yeah. So, and so you're a rookie at this?
Yeah, 20. I got it in 1992. I've been in business since.
You were about to say 20. You realize how far away from 20 that is? That's above 30 already. You know that.
33 years already.
Did you realize that?
Yeah, unfortunately, yeah.
How the heck? I mean, this is the first time I knew about this.
Yeah.
You didn't just jump into this out of like, you went to college. I'm going to go become a health insurance broker.
Nope, not at all.
You bought a coffee truck?
My father was in the business, and I did coffee trucks. I ran coffee trucks all summer during college. I ran them. I had cousins that had it, so they loved that they were able to go on vacation, and someone had to take care of the business. If you miss a stop, people get mad. Obviously, people are there at 10:01. You're there at 10:01. You can't be late. You have to be on time. And we were getting up at 3 a.m, filling up the trucks, getting ready, getting the coffee ready, and out.
Right.
So I did that for 5-6 years.
Okay.
And then my father bought one. I ran with him his summers. And then just before I left school, one came up for sale, and I bought one of my cousins. That was a really good stop in Elmwood Park. Just went up and down Market Street all day and worked out really good for 5-6 years. And then NAFTA came in and took JVC Electronics, my biggest stop, off to Mexico.
Oh, wow. NAFTA. Look at you quoting NAFTA. I was wondering where the heck that was going to come in today.
Some people say it was a great thing. Some people say it was a bad thing.
Right.
I know firsthand what it did, and I think it's turning around now. But
yeah.
How is that great to say, hey, listen, we're gonna incentivize you to leave the country and take the jobs with you?
No.
Makes no sense.
Well, politics aside, I mean, it's not good for business. I mean, if you forget about leaving the country. I was here, we are currently sitting on the property where Mercedes-Benz North America used to be for however many years. They left New Jersey as well.
Yes.
That was a big hit. There were a lot of them would come and visit me, and It was a big hit. So it's not just going international, and it's anytime it's not favorable for businesses in certain areas. It's
The state can't help you out, and they happy to leave. You're like, how do you let someone that big leave?
Yeah, listen, we went through this a couple of times in this area. That's for sure. So the coffee truck, what happens? It's overnight. It's dead, or it's
pretty much. I knew it was coming, so I was slowly getting out. Got out of the business. Got my insurance license. Started doing that. Ran, a part-time job. I worked for a temp agency, and I just in between those two, and then I also had a vending company, so I kept running the vending company.
All right.
So that was a little bit extra cash. Ran my father's on Saturday, and then little at a time made enough money that I can get rid of it all together.
And went into the health insurance broker business.
Yes.
How'd you start? Started working for somebody? You
started working for a company in Madison, New Jersey, and literally you stapled 50 things together every single morning, and you walked and talked. You knocked on 50 doors a day. Hey, would you like health insurance? And that's how I started. I literally didn't matter if it was summer, winter, I had thermals under my suit.
Yep.
And you knocked on doors.
102 degrees out like today?
Doesn't matter. You figure 1 out of every 12 is renewing that month.
Uh-huh.
And you get it 60 days prior, so 2 out of every 12 you should
So these are existing clients. They're not giving you cold calls. These are existing
No,
clients.
you were just literally walking down the street, walking into companies, knocking on doors. That's all I did.
1992.
Yes.
Pre-internet, all that kind of stuff.
That's it. Yep. Smile on my face. That was the best time not to be 6'2" and big.
Yeah.
Nobody was intimidated. Sometimes there's just a woman at the front desk.
Yeah.
Walk in the door. They're not. With a smile on my face. Nobody was intimidated or like, get out of the place.
Successful at that?
Built it up pretty well, and then slowly got away from there. He decided to change, and it was a 50-50 split, kind of how you started out. And then all of a sudden he decided he wanted to go 75-25. Me and a couple other guys left. One guy tried to jump on the internet wave in the city. He married an investment banker. He's a stay-at-home dad. And I bought his book of business, so I was able to get a book of business that was, able to live. I already owned a townhouse at that point, had my life going, so I kind of needed extra money, so it was perfect.
Wow.
Yeah, so it worked out really, really
Everything
well.
was just in the right place at the right time and everything like that. So what about the other guys that left?
He's still a stay-at-home.
No. You said that's the guy you booked the bait, but you said a few guys had left at that point for the 70s.
The other one was a nephew of his. He's out doing a good job as well.
Okay.
Yeah, so everybody did well. That guy's still making plenty of money, and just an angry little guy.
Got it. But it just goes to show. So 92, you opened up your own shop, or 92, you got involved in the business?
That's when I got my license.
Got it.
I kind of left on my own about 2002, I think.
All right.
This year.
So there's your 20. All right, now 23 years.
Yep.
But 32 years of experience. You got 23 years into this on your own.
Yep. I've seen companies come in, come out.
Yeah.
So it's interesting how the market, even in health insurance, you think that companies get in and stay in. Not necessarily.
What's the one that came in and came out?
Prudential came in and came out.
Of health insurance, right.
New York Life kind of jumped in on that. They jumped out. Chubb was another big company. That
Really? I never knew they were in health insurance. I know they were in auto, but...
Yeah, so now it's down to, in the ACA, the Affordable Care Act, there's only 3. Blue Cross, which is Horizon, AmeriHealth, which is the Blue Cross out of Philadelphia, and United Healthcare, who's the biggest guy in the United States, which is Oxford. And they now, all 3 of them, have a product on the outside of the ACA called level funding, where they're stealing all the healthy groups from the ACA, going outside and giving them better pricing.
Is this legal?
They're doing this, so I guess it's legal somehow. It's not that it's illegal, but it's medically underwritten. So if you have a healthy company, you should be out of the ACA because it's going to give you a better price.
Sure.
You're no longer age-based anymore, which is great. You go back to the 4-tier rating class, single, husband, wife, parent.
You think anybody knows what you're talking about right now? Nobody knows what you're talking about. So we've got, listen, it's the local BizCast. We've got businesses on here who provide health benefits for their employees. Do you do just commercial or do you do personal as well?
I'll do personal just if people come in and ask.
Got it. But
it's mostly companies 2 to 200, but my sweet spot is really 50 and below.
50 and below.
Yes.
Boom. We were right. We just nailed it right in that sweet spot, baby. Perfect. Right in that middle of that torpedo bat.
It's perfect. You're still talking to the owner, which is good, instead of a HR
benefits.
department.
Yeah, right.
So it gets to be less, you have to kiss less butts.
That's okay. I can understand that. All right, so go back to all these terms and everything like that. We talked about level funding. I didn't know what that was until obviously you educated me on that. Tiers, this, age base. You can assume that we know what you're talking about, but we're all in our own professions, and this is what I always kind of. I mean, listen, I know a lot about insurance being a medical provider, but we don't speak that language, right? And it's like, I used to have a contractor doing work.
Right.
And then you're expecting me to know contract stuff.
Right.
Like, where do you want to put the heat? I'm like, you're asking me where to put the heat? I'm a chiropractor. I don't know. You're supposed to tell me where to put the heat.
I want my place to be warm. That's it.
Yeah, exactly. Yeah. So tell us a little bit about the terminology, like what we're using. What are the tricks that the health insurance providers are now trying to get you to pay higher premiums or like offset some of your care, because care is getting really crappy right now.
That I have nothing to do with it. Unfortunately, they're going to do. But what happens, the ACA, the Affordable Care Act, guaranteed issue. What that means is, doesn't matter if everybody has cancer, they just look at your age and they take you in and they give you a rate. When the companies on the outside, the level funded, we send in their names, they go into the MIB and they look up what prescriptions everybody's on.
The MIB.
Medical Insurance Bureau.
There you go. I got you guys. You see this? I'm going to brain them in over here a little bit, throwing out freaking mnemonics and everything like that.
I could talk for hours on health insurance.
Yeah,
I love it.
good.
So,
I mean, we only have a half an hour, so
so it's good. So basically, what everybody does is they find out how healthy the group is.
Okay.
And this is how they come back and they give you now rates. And instead of paying age-based, which is you have a new employee coming in, if he's 24, it might be $500, but if he's 54, it's $900. So as an owner, he just looks, it's like, how can I be fair with that person and make it affordable for him? So they'll do a defined contribution, and he says, hey, I'm going to pay $400 a month no matter what you have. So the young guy that's at 500 pays 100. The older guy is paying 400 a month. Is that fair?
No,
not really at all.
Right.
But for the owner, it keeps him out of the lawsuit because he's saying, I'm being as fair as I possibly can.
Got it.
Level funded, now we'll go back to a true single rate. Husband and wife, we don't care how old anybody is. Parent-child, we don't care how many children there are. You can have 1 or 20 children, it's the same price. The same with family. So now it makes it a little bit easier. The next guy that walks in your door that you want to hire, doesn't matter if they're 24 or 54. We know that, hey, I know it's going to be $500 for the single rate. I don't care about the rest. They pay the rest if they want.
Got it.
They want to have a wife or children on the plan.
All right.
So it works out well. And now, but the wacky thing about this is, under the ACA, it doesn't matter. You don't know if you spent $1 million in claims or zero. They're never going to tell you. On the outside, they now come back and say, all right, you're paying $10,000 a month, $120,000 a year. We've already medically underwritten you. And they say, all right, we know we're collecting $120,000. We expect you to use about $50,000 in claims. So 1/12 of the $50,000 goes into a claims bucket. You go to the doctor. You get a prescription. Anything under $20,000 or $25,000 comes out of that claims bucket. If there's no money in there, there's an insurance policy that'll cover it. So we're never going to come back to you and ask for more money.
Okay.
And then at the end of the year, if you didn't use $50,000, you only used $30,000 and there's $20,000 left, they're going to give you 50% of that, which is amazing because the insurance companies are saying that they're not making any money, but now.
But somehow they're splitting a vig with
Exactly.
with the business.
Right.
Yeah, they're not making any money. This
Right.
is. Are we allowed to? This is not the podcast where I go unfiltered. I've got some podcasts I go unfiltered, but it's funny that you're going to tell me that you're not making any money, yet you have every other commercial on TV, which we all know how much that costs. I'm not saying the Super Bowl, but they are probably on the Super Bowl too.
Right.
We know that's not cheap. So how can you afford that? My company doesn't make that much money. We obviously can't afford to be on a national spot every other commercial for the next 700 years.
Right.
Don't make any money.
Prescription, there's a lot of, crazy stuff. Don't forget, every time you go to a doctor's office, there's probably a drug rep sitting in the doctor's office with you. And, is he bringing snacks? Is he bringing lunch? Is he bringing tickets to the doctor?
Yeah.
What's he bringing in by how many prescriptions you gave that person? Don't forget now, what's going on is you have a generic that's $7, and now we have a new drug that has supposedly a little bit different compound, and they're charging $500.
Mm-hmm.
If this doctor has 2,000 clients and 500 of them went from a $7 to a $500 drug,
boom,
it's a home run for these people.
Boom. I just don't get how the back end works. It doesn't make any sense, especially in my profession where we're trying to get people healthy and limit the reliance upon that kind of stuff. But yet it seems like they prefer to medicate people for the rest of their lives than to just fix a problem right now. We talk about this with like statins and drugs like that. Like, you'll put me on a statin. I'm 47 years old until I die at 90, whatever the heck it is. I can't imagine
if it doesn't kill you.
If it doesn't kill, it's got to be hundreds of thousands of dollars, if not millions of dollars, for 50 years worth of statins.
Yes.
Or we can train people and educate them on proper nutrition, what causes these problems, because the pill doesn't fix the ill, right? It's you're still doing the same stuff. In essence, we're putting you on statins just so you can continue to eat bacon cheeseburgers.
Yes.
But if you stop eating the bacon cheeseburgers and your cholesterol goes down, you don't need the statin. That's not reimbursable.
Right. The 300-pound guy that says, hey, all my numbers are great. Of course they're great because you're on 7 pills
Right.
to keep it good. And
That's okay.
listen, I'm 57 years old. People used to drop dead at 45, 55, and 65.
Yeah, that's right.
Now overweight people are living into their 80s and 90s.
Okay, so we're saying this is what we need. I don't know. Sorry, that's
No,
that's a philosophical,
Right.
I guess, issue and stuff like that. But going back to the health insurance and stuff like that. Do you only do New Jersey or do you do?
I have my license for New York, New Jersey, and Pennsylvania. I do mostly New Jersey. New York is really in not a good shape right now when it comes to health insurance.
Okay.
Unless you go over 100 people, they're not allowing you to do level funded.
Oh, okay.
So Empire, who's the Blue Cross in New York, basically pulled out of the small group market because it's such a mess.
The fact is, you're saying that this is beneficial to the employers and to the health insurance companies because you're plucking out the most healthy people,
Yes.
which is effective for them.
Yes.
So why would they not be doing this in New York?
New York is corrupt and there's a lot of bad things that go on.
Oh, New Jersey's perfectly
you-
clean.
yeah.
Got it. You guys heard it here first. Mike McGowan knows, obviously, cleanest state in the union, I guess, over here.
Well, New York used to be a sheet rated, so it didn't matter if you were 10 or 25, you would just go on a sheet, and that's the way it was.
Right.
But those rates, there was a single rate of $1,000 back 10 years ago. And that's a ridiculous number for an owner of a company. I used to do a hotel in the city, it used to be great. A company came in, something Republic, they came in and they just lowered the rates, went across the board. I sold a bunch of that, and then that imploded. And anybody that's under 20 people should be in a PEO in the city.
Got it.
Is basically where they're all going to.
Oh, I mean, I figured PEOs were for larger companies, but they're
No.
expensive,
Right.
PEOs.
You're going to pay a lot, but when you think about how much you're going to save
Yes,
in health
sir.
insurance,
Sure.
it makes sense for them.
And do you do PEOs as well?
I have people that will go in and they believe it or not, they still compensate us a little bit.
Yeah.
To come in and show them where to go.
Well, I mean, the companies do, but then
Yes.
you outsource the PEO
Yes.
to
Yep.
another company. Got it.
It makes sense
What
for
is a
certain
PEO for another mnemonic you threw out over there?
Let's see.
Professional Employment Organization, is that
Yes,
it?
it is.
I'm telling you, your job.
That's exactly
I've
what it
been
is.
doing this for way too long. I've been hit up by brokers like this guy all the time over here. No, I mean, listen, without a doubt, and I've had, as I just said, multiple brokers. So this is from a personal testimonial. Nobody has beaten you by far. And then on top of that, he brings me a check. One of those things that you used to get like on, The Price is Right, those big checks. He would bring it in over there like a real big check. He's right. They paid us back some of our premiums that we've had paid for our employees. Name somebody. I don't know another broker has ever done that for anybody. So.
Nobody.
So tell me a little bit more about you. What makes you unique and specific in your game?
Starting with the coffee trucks, you always have to be on time. I think it's so important to be early to every single meeting. People that are late, it's disrespectful for the person that you're going to see.
Oh, ain't that the truth?
Everybody gets a call back that day. I learned my lesson a long time ago. If you don't call people back, they yell at you the next day. Listen,
Or they move on to the next guy.
exactly. So every single person gets a call back. In my office, nothing goes to voicemail. Somebody picks up my phone every time in the office. I have a great staff that takes care of that because that's important. Nobody likes to go to the voicemail hell or go hit this button, It
Yes.
aggravates me so much that I make sure it doesn't happen. And
Does not create the wow experience.
Not at all. And I have about 300 groups under management, and I don't lose business. Just
No
because-
attrition.
Nope. I call people back, and people are happy to get the call back, and they understand that I know what the problem is. Once they know someone knows the problem, because half the time if it's their wife that something happened and they just got yelled at, and that's what it is. They got yelled at, so they're going to yell at me.
Yeah, that just goes down the chain.
Right. And I get yelled at, and nobody can offend me. People yell at me. They'll call the next day. They're like, I'm really sorry. I'm like, listen, if I got offended in this business from someone yelling at me,
Sure.
I wouldn't be in this business.
Yep.
So it's not a big deal. Listen, we all get yelled at.
We all get yelled at.
If you take it personal, then you know what? That's
That's the truth. I think you hit on some key business pearls of knowledge with regards to how you run a business, and it could be anything. As I said, it could be a coffee truck, it could be a retail store. It doesn't matter. You do business in a certain way. Just calling people back, being on time. One of the biggest things that I always say in my office, because a lot of medical has gone to the voiceover, where press 1 for this department. No, I think humans. I think we need to get back to humans answering the phone, even if it's like, "Hey, good afternoon, this is Swan Health Center. Hold on for just 1 second. We'll get back to you in just a second."
Right.
Just that,
Because how many people are sitting around doing nothing? It's like, answer the phone.
Yeah.
It's going to kill them.
Yep.
And everybody needs more personal skills. These kids are sitting there with their phone way too much.
Yeah, they don't know how to talk.
I have no children, but I see a lot, and I'm not happy with the way.
It's so true.
No one's taking my business. No one's taking my job in the next 10 years. I'm going to sail right into retirement.
That's it, huh?
Sell my
Chat
business,
GPT, AI, nothing.
No chance.
Nobody.
Take my business.
No.
Which is great.
There you go.
So.
It's just you have to worry about just different changes that are going
Right.
on in the insurance
Industry.
environment,
Right.
right? Of course. So
I can retire tomorrow, but I will go another 10 years.
You're going to go another 10 years?
Yeah, it's 67. Sell the block of business. And,
There you go.
Retire and have a great life.
Ta-da.
Yeah.
But you heard it here first. Few more years, the Benefit Bureau will be on the market for all my investors over there. That's for sure. What do they need to know, though? You can't just run this thing. I mean, what?
I love hearing that Accusure is a big company that's buying out insurance
Sure
companies.
is.
I love when I go into places like, well, Accusure bought out my block business. I said, listen, right now nobody's taking care of your business. They gave it to somebody that just got their license that has no idea about health insurance. Why don't you just let me just sign right here? Let me take care of it, and I will get it where it should be. And now you're gonna have somebody to call. And I said, you'll have somebody to yell at if there's a problem.
How many months does it take for them to, if they don't take you up on that offer right away, how long is it like, God, I can't stand them anymore?
No, I get them right off the bat.
Right off the bat.
I just sit there and explain exactly what's going on, and because they've already been there for 6-8 months.
Got it.
And it's like the renewal's up, and it's like, did they call you yet? Well, no. Oh, well, no one's going to call you. I'm like, nobody came in and start presenting what's going to happen.
Different
this year, 'cause
options, different
you
plans.
You get it 60 days prior. I start calling people early, making sure that they.
There's a lot of work. So we're currently going through this right now.
Right.
Sometimes it's a lot of work,
Right.
especially if you're going to change carriers,
Right.
right? So
I did all the work on the backside, getting the carriers, getting Blue Cross's rates, getting Aetna's rates that weren't better. So the good thing is this year we're staying where we are.
right.
At Oxford's rates, we have an under $400 rate, which is incredible.
Well, don't tell people that. Come on, don't tell my employees that. They don't know. Of course, they have to know. They're paying for part of it, right? So,
But it is an amazing number.
guys, like, is it always the same? Like, does everybody on Oxford right now is because that's the one in New Jersey, or you have different clients or have different?
Comes down how healthy. You have a healthy group.
Yeah.
When it comes down to listen, you could have 10 people and one person could be very unhealthy. They're on that 8 o'clock drug.
Yeah.
Which is that drug that costs $1,500 a month. Think about it. That's an $18,000 spend. That person's paying $500 a month in premium, and the company's paying out $1,800. That's a big difference. So
Yeah.
every time they put one person on that drug, that could throw off the commission, the census altogether by just one person.
Wow.
Which is ridiculous.
Sure.
That's why people really should start thinking about if the generic worked, you don't need to go to a name brand drug. It's really only one. You would know how many really ingredients did they really change to go over to this new drug?
Again, after 7 years or whatever it used to be 7 years, it could be the exact same medication, of course. And the pharmaceutical companies are going to make it more and more difficult for people to copy their meds and stuff like that. But with technology, it should be easier and easier to create it. I mean, it just, I don't know. I mean, and there's all this other stuff out there. There's healthier alternatives. I just saw something. Did you see this? I don't know. I mean, I'm into the health. I like a light. A light. It's
Red light? Yep.
Not even red light. They used a light to blast a cancer cell. Just light. Light. No medication. No chemo. No nothing. They were able to kill a cancer cell with light. Right? I have laser. We talked about this. I have a class 4 photomodulation laser that creates unbelievable results. Considered experimental. You know how long it's been out? A lot longer than you've been doing your business in 1992,
Really?
20 or 30. Yeah.
Really?
How is that still experimental? The research is out there. The benefits are out there. The results I get every single day is out there.
Because it's not expensive. They can't charge what they want to charge. The money. And
It's all about the money.
These drug companies are making billions of dollars. And listen, they spend a lot of money on research, and thank God they do.
The drug companies.
Because if they didn't, we would be still.
But
Be sexy.
we are also funding that as well. They're getting grants. They wouldn't be able to do this research without the grants. Where are those grants coming from?
Our taxes.
Your tax dollars.
That's amazing.
And it was really exposed during, the thing that came here a few years ago with regards to we're paying our tax dollars towards that. And, it's expensive to do this kind of stuff. But when it comes to the profit, we do not share in the profits.
No, billions and billions of
That's
dollars.
correct. We don't share in those profits. So how can we get to pay for it as if we're business partners, and yet we get no benefit from it? Come on, explain that to me.
Because the government's getting kickback. Someone has to pay for their elections. Someone has to pay for.
Well, are we allowed to say that, or are we going to get shut down? Toros, you let me know. We just got shut down. We'll have to refilm this one, of
shot.
course. It's over like that. So, going back to your ideal customer, you said anybody under 50 employees is just your sweet spot. I mean, it's just...
that and people turning 65 going on to Medicare.
Okay.
Medicare is a big thing. I'm surprised they're not dancing on the stage. They changed the drug card where for 2025 it's a $2,000 max, which is great because obviously you don't want to see any of your parents or your grandparents losing their house because of prescriptions. But on the other hand, they had that $7 drug. There's now an incentive to give them the more expensive drug because they know once that person pays $2,000, they're done for the calendar year.
The patient doesn't have to pay. Their out-of-pocket maximum.
Out-of-pocket max is $2,000. It's
Got it.
crazy. And you would think everybody would hear about that. That has been kept so quiet because...
because the insurance companies don't want to know, know about it.
the
Medicare doesn't want it.
Drug companies love it. That's what.
Of course, they're going to pay a premium on it, right?
Every single person is going to be on a new drug over the next 5 years, guaranteed. The doctor's offices will once again go to the more expensive drug every single time for these people because they can. Give it to them free for 2 months, and there's your $2,000. And
wow.
now they're off to the races. Once again, there's $12,000 a year in spend just on one drug.
But it's like, why would the I guess if the reps are taking care of them, which
right.
so allegedly was get made illegal,
right. Anything else, if you did that in any other industry,
it's kickback.
It's kickback. It would be absolutely illegal in every other industry.
And it just doesn't make any sense most of the time when the prescribing physician prescribes it. The pharmacy makes the profit on that, not the doctor.
The PBM, don't forget.
Yeah.
CVS is the biggest drug dealer in the United States, and they own the third largest insurance company in the United States.
That's correct.
CVS, or Aetna.
Yeah.
How did that happen?
And they own the pharmacy benefit manager, right. PBM, and they own the third-party administrators that do that, and they own.
No, how that slipped by anybody, I have no idea.
The people responsible for delivering the care now are responsible for paying the bill. Now are responsible for paying the they have created those pillars. What do they call it? Funnels up like right. from beginning to end.
Right.
How is that not a conflict of interest?
It absolutely is because now they kind of tell you, hey, we want you to go to CVS opposed to Walgreens or anybody else. So the mom and pop shops are the ones that.
When this first happened, I think was Walgreens stopped taking Aetna.
Yeah.
Right.
Yep.
So they didn't even take Aetna. Like
they're in bed because they're in bed with Oxford United.
And this is what you help navigate for us because I mean, what is the biggest complaint you get from customers like us? Like, I mean,
is my doctor in it?
Yeah.
What prescriptions? Are they going to be covered? Because I take this one prescription, I had to get it pre-approved. That's what my staff takes care of. Anytime anybody wants me to come in and step in and help out, you get me the explanation benefits. We're going to call on your behalf. And Melissa really fights for. As if it's her own.
Got it.
She has some health issues, so she knows how to navigate through it.
Yeah.
She's been with me a bunch of years, and I even share a dog with her, so she can't leave for the next 12 years.
There you go.
So,
she got her on lockdown. It's either the dog or a chain to the desk. Either way, they're both pretty excited. Yeah. And again, she does that work for us as well, and that's incredible. You said you have 300 clients under your book, and you would do that for absolutely everyone.
You have to.
You have to. It's what makes you different than everybody else. How much competition is out there for you?
There is
Acrisure, of course, right. But that's not even competition because
that's the best thing for us to happen. What happens is there's no new brokers coming in. In the beginning, I was one of the youngest brokers. Now you go to these meetings, it's all older people,
right? Because
it's an annuity in this business. So why leave the business?
Yeah. It's the truth. Listen, in my business, as you said, like it's not going in the right direction. My business has gone private equity. Healthcare has gone to private equity, and they're no longer interested in the healthcare of the patient right now. Right? It's only about cash. Dollars and cents. Right. They become units, relative value units. A patient becomes a unit. They're not even a patient anymore. So we don't do things the same way. We provide a tremendous amount of exceptional care. We spend time with patients, and these private equity mills can't do that because they have to just churn them. Right. So the more that happens, the more patients out there are getting frustrated. It's the same in your business.
Right. So they come to you, and you're happy to take them.
Absolutely. I mean, don't get me wrong. We're not the cheapest people out there. That's for sure. But this is what I always say, and forgive me, I don't want to usurp your last couple of minutes, but you're going to go to one of these private equity mills for physical therapy, say. You get 30 visits a year. So you're going to go there 30 days of your life, right? You have a $50 copay, because I haven't seen anything cheaper than that. That's $1,500 and 30 days of your life.
Right.
For me, my visits are $130, not 50 or 130. Right. However, I'm going to do it in 8 to 10 visits. Let's call it 10 visits. $130, that's $1,300. Already you're saving $200. Right. 20 days of your life you're saving. Tell me what the value of that is. And you know what the best part is? You actually get better.
That's the most important thing.
You actually get better. So you're saving time, you're saving money, and you're getting the results that you were looking for. So how much longer do I have to hang on before, people can't, are you in my network? Are you in my network? Are you in my network?
Right.
Well, no, we can't afford to accept the rates that these networks want to provide for us. So
and keep the doors open.
Keep the doors open. It's not, listen, doctors are not driving Ferraris anymore. Those days, the Mercedes 80s are over. Right now, we're just looking to keep our lights on so that we can provide good care for patients. I mean, that's the goal right now. And and again, you're finding good quality products, that are our employees can use, our team members can use, and stuff like that. So again, big testimonial to Mike Magaro over here of the Benefit Bureau. So official. I love it, man. What else do you want the people to know? How could they find you? Where is the best place to go?
The Michael Magaro at thebenefitbureau.com.
You got social media?
I am on Facebook, the Benefit Bureau as well.
He's showing his age, ladies and gentlemen. Oh, Facebook. We got to get this guy on Instagram, little TikTok. Did he look good on TikTok? This is one over here.
I think TikTok is the reason why I think we're learning about all these new drugs and how to stay healthy.
Oh, yeah, of course.
And I think that's why
it used to be Dr. Google. Now it's Dr. TikTok and Dr. AI and everything like that. So
I've learned, I've taken a few things that I've seen on there.
Yeah.
Just feel better about yourself.
Yeah.
I want to live into my 90s and 100 healthy.
Healthy.
It is the most important part.
Absolutely.
So my mother's 94. Take her out to dinner every Tuesday.
There you go. Where are we going? Where are we going tomorrow?
Grasshopper every Tuesday.
Grasshopper on 23?
No, the one in Wayne.
Yeah. All right.
Right over the railroad tracks.
Yeah. All right. You heard it here first. Tuesdays at the Grasshopper. There we go. Anyway, guys, ladies, I'm telling you from personal experience, I get to share this with you. He has been terrific. If you've got pictures somewhere of our big check that you provided for us, right? So he just went through our thing. Now we're up in what, July, August?
Yes.
I mean, it's coming soon, so we went through it. Everything was prepared for us. He has done everything from soup to nuts. It requires us, obviously, to do our basic stuff. But, I mean, as you said, like the fact that you reached out to tell us this is coming up as opposed to us having to tell you, and what if we missed it, right? I mean, I'm sure your options become a little bit more limited if you screw that up.
Yeah, and when you only have a certain amount of time. With level funding, it's a 12-month contract. It's not like a month-to-month contract, so we have to make sure we have to be efficient.
Got it.
So, great.
Well, thank you very much.
Hey, thank you.
I thought that was pretty informational. I hope you guys enjoyed that. First insurance broker we've had on here, so I hope it was helpful for you. If you guys are looking for any type of health insurance benefits and or going into your Medicare, which was a huge thing for my mother and everything like that, Michael Magaro with the Benefits Bureau. Ladies and gentlemen, that's it for the local BizCast for today. Again, I'm Dr. Pete. If anybody was looking to get onto the local BizCast, you want to try that again? If you're trying to get onto the local BizCast, I promise you I will pronunciate it or enunciate it correctly next time. Come find me. You can find me on social media at Instagram at @TheDrPete, at TikTok at @TheDrPete, or Peter Wohl on Facebook. Or you can get me at my email, drpete@shcnj.com. As always, it's been a pleasure. We'll see you guys next time on the local BizCast. Thank you so much, Mike, for joining us.
Perfect. Thank you.